Firstly, my name is Joel Briere, and I am founder of Tandava Retreats and co-founder of F.I.V.E, MeO DMT Information and Vital Education. And my amazing co-founder here, our hostess with the mostest.
Thank you for that beautiful description. I am Victoria Wishner. I'm the hostess with the mostest, co-founder and president of F.I.V.E, again, F.I.V.E, MeO DMT Information and Vital Education. And I'm also a retreat leader at Tandava Retreats as well. And so, yeah, want to share a little bit with you guys. If you're not familiar with F.I.V.E, maybe it's your first time joining us and you're a little bit curious of who we are, I'll share a little bit about us. Our mission at F.I.V.E is to help shepherd F.I.V.E MeO DMT into the world in a safe and effective manner, starting with a centralized hub for resources and education on F.I.V.E MeO DMT, and by engaging in research and drug discovery. Our website includes over 30 pages of free information on F.I.V.E MeO DMT, including integration specialists, informational webinars, scientific research, and more. In addition, F.I.V.E is known as the gold standard in F.I.V.E MeO DMT trainings, offering the highest standard of education to both facilitators and integration specialists. And so today, our informational webinar is going to be on ethics in F.I.V.E MeO DMT facilitation trainings. And we're lucky enough to have some amazing guests with us here. We have Roger Kaufman and we have Dr. Rick Barnett. And just so you can get to know them a little bit more as well, I'm going to share their bios with you guys. So Dr. Rick Barnett is a clinical psychologist and addiction specialist. Dr. Rick Barnett holds a bachelor's degree in psychology from Columbia University, a doctorate and master's degree in clinical psychology, and a master's degree in clinical psychopharmacology. Dr. Barnett completed the year-long certificate program for psychedelic therapy and research through the CIIS. He completed ketamine-assisted psychotherapy training with Polaris Insight Center, as well as a year-long trauma-informed F.I.V.E MeO DMT facilitator training program through F.I.V.E. Dr. Rick Barnett founded the nonprofit organization Carter Inc. in 2015 to expand addiction-related resources in Vermont. In addition to serving as secretary for the Psychedelics and Recovery Board of Directors, he has served on several nonprofit boards during his career. Rick is in long-term recovery from addiction, and he maintains a private practice in Stowe, Vermont. He is an active advocate for mental health and addiction prevention, treatment, and recovery. And then we have Roger Kaufman. Roger Kaufman is a licensed psychotherapist in California and Arizona, an adjunct professor in the Masters of Psychology program at Antioch University, Los Angeles, a 2023 graduate of the F.I.V.E Facilitator Training Program, and now one of the supportive teachers for that same training program. He co-facilitates small weekend retreats in the Sonoran Desert, providing carefully titrated first-time full-release experiences with F.I.V.E MeO DMT. So yeah, thank you both so much again for taking the time to join us. Joelle, I'll hand it over to you.
All right. So let's get the fun stuff out of the way with our disclaimer. F.I.V.E is focused on providing the world with resources to educate, inform, and promote harm reduction. The content of this webinar has not been evaluated by the FDA. F.I.V.E MeO DMT should not be used to diagnose, treat, cure, or prevent any diseases or condition. F.I.V.E does not endorse or promote the use of F.I.V.E MeO DMT and does not encourage or condone any illegal activities. You are solely responsible for understanding and complying with all laws that may be applicable to you. All right. Now that we've gotten that out of the way, how's it going to work tonight? So we're going to have a kind of presentation done panel style with Roger and Dr. Rick and myself, with Victoria moderating and asking questions and sharing some of her own wisdom as well. There is a questions tab, and anytime you want, you can hit the Q&A and just throw any questions in there. Towards the end, we're going to take the last 15 to 30 minutes and answer questions. And please keep the discussion questions relevant to the topic, and please keep them respectful and courteous. And please do not ask where to source illegal substances. I think that's about it.
Yeah, perfect. Well, I think it's important as we are kind of heading into this topic that we give it a little bit of context, in that way that we can understand why we are where we are right now. And then from there, we can start to create solutions together. So Joel, I'm going to fire off the first question to you about why this webinar is even relevant in the first place.
Yeah, absolutely. Um, I think this webinar is relevant because 5-MeO DMT, as we've shared before in a lot of information, 5-MeO DMT is a bit of a different beast than any other plant medicine or psychedelic, as I'm sure pretty much everyone in this audience has known. And it has its own nuances and requires a really, really in-depth understanding of how to care for someone and help prepare someone and help support someone on their way back from what can be the most profound experience of someone's life. Unfortunately, to date, there haven't been a lot of, we'll say, stellar training programs out there. Of course, first we have the issue of legality. So a lot of training programs have been underground and very, very hard to access by the general public. And then we've had a lot of training programs emerge that are very short periods of time. Some that are 2 weeks, some that are 2 months, some that are a few days. And I hope that everyone in here can agree that we probably can't learn how to safely and effectively serve the world's safest molecule in a few days, or the world's most powerful molecule in a few days. And so we feel, and yeah, we feel that it is very important that there are above ground, well informed facilitation trainings for 5-MeO DMT. There's been a lot of people stepping into facilitation without personal experience, and that brings its own sets of issues that I'm sure we'll get into. And there's been a lot of people stepping into facilitation that haven't necessarily undergone mentorship or training, and that has its own areas of issues. But yeah, I think that gets it.
Yeah, and just to kind of piggyback off that, Joel, would
Mm,
you explain why 5-MeO DMT is different than others and why it requires different skill sets?
yeah, for anyone who may not be personally familiar with the 5-MeO DMT experience, we are talking about a molecule that, unlike all other serotonergic psychedelics, targets the 5-HT1A receptor rather than 5-HT2A. This results in a rather than a subjective journey where I go on a journey and I may see things and witness things and receive information. It's more that sense of divinity or that sense of self that's dissolving away, that sense of I. So the experience is a lot harder to understand or comprehend. And sometimes there's not even memory of the experience. And so just the profundity of the experience alone is going to require its own set of understanding. And and as well as being able to navigate and unpack a process that involves an experience that we might not remember.
Mhm. All right. Roger and Rick, due to evangelical articles in the media and a lack of solid education, many facilitators, as well as many potential participants, might think that 5-MeO DMT is a cure-all, while the reality is that 5-MeO DMT may not always be a good fit for everyone. Can you speak to the importance of being able to determine who is a good fit for you to serve?
Roger, you want to go first?
Sure. Thank you, Rick. Um, this is for me still an evolving understanding and learning. Always want to approach this with beginner's mind because I think what I'm discovering is that we encounter the individuality of each person that wants to experience 5-MeO DMT and how what that person's life experience is, what their psychological makeup is. How they're going to respond, like what Joelle was just describing around experience that might be the most profound in their life and might be incredibly disorienting, especially initially. How we make sense of who's going to be the right fit for that feels essential. And that is the person's life experience, the person's current circumstances, like I said, their psychological makeup, maybe trauma that they've had, like what level of trauma they've had. There's so many different factors to consider.
Mhm. Mhm.
And just to add to that, I think also, even in the introduction of this webinar, as Joelle was talking, and thanks for having us, by the way, I, there's this phenomena of like the world's most powerful psychedelic, and you hear that. And of course you hear from the studies on psilocybin, Roland Griffiths or RIP used to always say, cite the research saying, people report this is one of the top 5 most significant experiences of their whole life. And you hear that about psilocybin research. Now you take 5-MeO, again, add that layer of this is the world's most powerful psychedelic. Who are we attracting to some extent to this? Some people novelty seeking, sensation seeking, adrenaline seeking, or people who are extremely desperate and like, I really need to go for the biggest, most powerful thing. And we need to talk to people about what is their motivation for this experience along the lines of everything that Roger was saying, being really sensitive to trauma and past experiences with or without psychedelics. Um, you know, Obviously all the same screening that we do with mental health background and family of origin. And I think that's one of the most important things to think about, the motivation for people seeking this experience and really diving into that with people before they actually come and have an experience.
Mm. Hmm. Yeah, that's so great. Yeah, there's so many things to think about, all the little nuances as well. Like, what are their relationship to spirituality? What's their relationship like to death, to control? What's their home life like? If they have this experience that shakes things up a little bit, are they in a stable situation to be able to integrate it? Yeah, there's so many things to think about when we're talking about 5-MeO DMT. Um, so I have a question for you, Rick. As 5-MeO DMT is a trigger for catharsis of the body and psyche, can you explain why it is crucial that facilitators have at least a basic trauma-informed understanding?
Yeah, absolutely. It's so important. And the 5 training that Roger and I did together with you guys in 2023 is called Trauma Informed 5-MeO Facilitator Training. So trauma informed is the most important thing. Joelle said it at the beginning, safety, safety, safety. We have to have a basic understanding of trauma because safety is so important when it comes to this particular molecule. People who have had trauma, their sense of safety has been completely shattered. And to bring them into an experience where they're going to be, once again, completely shattered, but hopefully in a healing container, it's really important that we have a basic understanding of how important it is to create a safe container, to develop a sense of trustworthiness or, fidelity to our practices, to collaborate with the person, to really make it a sense of teamwork, that we're, with the training with you guys, we're always checking in with people who are participating in these experiences. What are some things that are aversive to you? What are some things that are like senses and sounds and tastes and, all of their past experiences that could trigger a trauma? And, even with our best attempts, and you guys, we all know this, is that we can't screen this for everybody. There's underlying trauma where people had no idea that something existed in their body, in their hearts, in their spirits. It could be generational trauma that just people were completely unaware of, and it comes out in these experiences. We witness it with these huge cathartic events, and if we're not prepared for that as facilitators with thorough training, we can lose our bearings quite easily. So it's super important to have that basic understanding.
Mm. Hmm. Yeah. And so this kind of goes right into the question too, Joelle. Unfortunately, many participants have had trauma resurface or even felt traumatized by their session. Can you share more about this? You're muted.
I guess maybe I'll unmute myself. I think there's a few things that can go into that. Um, firstly, if we are having an experience where there's a cessation of self-activity, then we need to take into consideration the implications of what that really means. That means all of the layers of sense of individual self are going offline. That means all of our defense mechanisms and all of the parts of our psyche that may be protecting us from experiencing certain emotions or holding in and suppressing certain memories, things like this, they may go offline, allowing those things to come right to surface. There's been plenty of cases, and I've seen them personally, of people having suppressed childhood traumatic memories come to surface. I've had people have traumatic physical injury memories come back to surface. Um, if there is a very traumatic incident that part of their awareness is still stuck there, there's a significant chance that their experience may take them right there, and they may go back and visit that traumatic event in a very, very visceral and amplified way. And it's not to say that that's a bad thing, so to say. That's something that can bring up the catharsis that is really the bridge to what's on the other side of that. But if someone, one, is not prepared for that to come up, if someone is stepping up to do 5-MeO and they don't know that that's a possibility, then there's not exactly consent taking place. If a facilitator does not have the necessary skill sets, frameworks, or understandings to help a participant navigate that resurfaced trauma, then there can be some extreme destabilization afterwards. And so, yeah, hope that answered it.
Yeah, absolutely. And, I think that it kind of leads into the next question, which is going to be talking about skill sets. I think when we're talking about trauma, I think it's not to say that as facilitators, we shouldn't work with people with trauma. I think psychedelics can be really supportive to the process, but being able to understand, yeah, where are my skill sets? Where do I need to bring in support? How do I need to create this container specific to this person who's bringing this trauma to work with me? And so, yeah, here we go. Roger, as you teach a segment in the F.I.V.E. training on psychological disorders, can you explain why it is crucial that facilitators have a basic understanding of psychological disorders and why it is important for facilitators to stay within their skill sets?
So I think maybe a place to start with that is that our understanding of psychological disorders is by no means perfect. The DSM, as many people are probably familiar with these days, because we tend to throw around, like in social media, all kinds of different disorders like narcissism, borderline personality, schizophrenia. Um, but understanding psychological disorders, I think, is really an attempt to come up with a way of describing different ways of human suffering. And so the more that we can develop empathy and curiosity and understanding of how the individual that we're in relationship with, like a person who wants to do 5-MeO DMT, the more that we can understand that person and all their different aspects, including if they have specific psychological disorders, then that's going to be essential in terms of how we support them. And even if we decide that we feel that we can ethically serve them. So there's a big range there in terms of psychological disorders, all the way from like generalized anxiety disorder, where most people with generalized anxiety disorder are going to be good candidates for working with 5-MeO DMT, all the way to schizophrenia, where the risk for activating psychosis is too high. And then we would want to help that person find other forms of support. So, and then in terms of the skill set for facilitators, I think it's essential, and I think we'll talk more about this as we go through this webinar, but I think it's essential that we know our own limitations as well as our own strengths as facilitators. And there's going to be some people that we're going to be a good fit for, because of our training, because of our life experience. And then there's going to be other people, for example, maybe someone who has a particular kind of sexual trauma that we may not feel that we have the skill sets for. So self-awareness on the part of the facilitator, really, really delicate empathy and sensitivity to the potential participant. I think those are key factors in terms of determining what's going to work best.
Mm-hmm.
Hey, Roger,
Yeah.
real quick, we had a question from Ms. Grace. Would you just go a little bit and explain a little more around extreme depersonalization? That was a great question.
So extreme depersonalization would be a situation where the person actually loses, and we want to distinguish between a depersonalization that's happening because of a dissociative process that's probably related to trauma, or could be related to an organic brain disorder like schizophrenia. But we want to distinguish that from certain kinds of profound spiritual experiences that can happen on 5-MeO DMT. So, but extreme depersonalization in a psychological sense would be where a person actually detaches from their sense of self, and not in a way. There's an irony here, which is that in order to, um, I think, have the most effective 5-MeO DMT experience, individuals need a certain kind of basic ego strength and coherence. In other words, we need to have an ego in order to release the ego. So a lot people talk a lot about ego death around like 5-MeO experiences. But if you're not coherent and cohesive as an individual, then when that ego dissolves in a big, profound, full release experience, then you may not be able to navigate that very well. So extreme depersonalization suggests that a person has pretty severe trauma.
Mhm.
Thank
So
you.
we want to be real careful about that.
Yeah, thank you. Yeah, and just to kind of preface this next question, something that I think is really cool, really unique and special about 5-MeO is that this is a really new medicine. And as it's a new medicine, unlike like ayahuasca, for example, where there's decades and even a life that's dedicated to building relationship with the medicine, with being in mentorship with a mentor that's shining lights on your blind spots, and even, yeah, getting to do such deep self-inquiry. Because it's a new medicine, it's a totally different ball game. And so this next question, Rick and Roger, from your standpoint, in what ways can it be dangerous for a participant if their facilitator has not done their own personal work first?
Rick?
Uh, it's yeah, we have to know what this medicine is. I think I think it's safe to say that with this particular medicine, people who are serving it better have had some substantial experience with the medicine because it's just so different than some of the other ones. I think in other contexts, I've said this before in other webinars and with different groups of people, the question comes up, do you need to do psilocybin to facilitate psilocybin therapy? Do you need to do MDMA to facilitate MDMA? Do you need to, that, and I've said the answer to that is not necessarily, because you can have altered states, consciousness state, Kundalini yoga, with breath work, with all kinds of things. I would make an exception with 5-MeO DMT because it is so, so powerful and so unlike any of these other types of experiences that if you haven't had your own experience with it, you really just don't have, you can't personally embody the container and be the presence you need to be with somebody who's undergoing that kind of experience. It's super important. And frankly, it's irresponsible. It's irresponsible. And you preface the question, Victoria, with the newness of this medicine. And just to add to that, the proliferation of it. You guys did a webinar a year ago about 5 vape pens and vape pens, pen safety, because pens are more and more widely available, and it's runs the risk of not being taken as seriously. People misusing it, and not holding it with the kind of sacred reverence that we need to hold it with. And so I think, again, same thing, just to piggyback on that, needing to have your own experience with this medicine to be able to, walk people through the experience from the very first discovery call, contact with the person, all the way through to sometimes long after their full release experience. It could be a long-term kind of thing because it's so overwhelming. Roger, you probably have definitely some things to add to that.
Thank you, Rick. So I think there's two levels here, Rick. I think I appreciate how you were focusing on prior experience with the molecule itself, which I strongly, deeply agree is so essential. And one aspect of, well, I'm sorry, let me interrupt myself. So then another aspect that I'll get to in a minute is our own inner work, even prior to our experience with the molecule. So, but going back to Rick, what you were focusing on, just one aspect to highlight is that when you're facilitating an experience with 5-MeO DMT, what's happening inside the person can be very different from their outward expression. So if you haven't had your own experience with the molecule, actually going in as a participant yourself, then you may not understand what's happening, because people can have all kinds of ways of expressing themselves or not expressing themselves during a 5 experience. And so having that prior experience yourself can be so essential. And there's so many other points there, but maybe shifting over to my own, as facilitators, having done our own inner work, my own personal experience with 5-MeO DMT it has highlighted aspects of my own trauma and just the own intensity of life, that decades of work as a client in psychotherapy, as a psychotherapist, as an educator, didn't actually touch. 5 has this remarkable ability to light up aspects of our life experience. And as I think others have already shared here, even like, I think, Rick, you said this earlier, intergenerational trauma, 5 can light up things that haven't seen light before. And so the facilitator needs to be really ready for anything. And as I'm learning in the process of being a facilitator, and it was just really wonderful, the experiential part of our training with the 5 Institute, in terms of witnessing so many other people having 5 experiences, in terms of the other people in our cohort, to really be unshakable in the face of all kinds of different people. Can have huge cathartic releases there. It can be sobbing, it can be screams, it can be dynamic body movements. Some people, of course, can be very still during the experience, which comes with its own kind of curiosity and mystery. But being prepared internally to handle whatever is happening in the ceremony space seems essential.
Mm-hmm. Beautiful. Yeah, and you guys' answers kind of touched on the next question. So I'm going to read it, and I'm actually, Joelle, if something pops up for you, or if Roger or Rick, anything else pops up for you guys, I think that's a really important question. Something that we see quite frequently as we open up for our cohorts are therapists who have not sat with 5-MeO and are wanting to do the program. And then we kind of share our prerequisites and why we have those prerequisites in place. And yeah, I think it's a good thing that we can talk about, so we can understand a little bit more about it. So the question is, many therapists are beginning to add psychedelics to their toolkits in order to better serve their clients. Can you share why it might be dangerous, even for mental health professionals, to begin offering 5-MeO DMT without thorough training and personal experience?
I think luckily we did just speak to that a bunch, but I would, I would just offer that the experience that 5-MeO can offer, I think glimpsing that experience is an important ingredient in being able to really hold space for that experience, because as Roger was just saying, it can display in a lot of different ways, and some ways look like an emergency. Some ways look like in all other situations, emergency protocols would be activated. And I think it almost takes going to the depths of that experience to understand that their experience may look wild, but it's and I don't really know exactly what I'm trying to say there, but there's just something that is unlocked by going into that experience that allows us to be present for it in a way that is very hard to explain, but is noticed by participants. One of the common things we hear a lot when they come out is they say, they came out and they're like, wait, what was that? But then I looked at, one of you, and it just felt like you knew, you understood. And it's whatever that is, that connection that people have that have been to that depth, the connection that is shared of those who have glimpsed that, whatever it is there's something there. And I think while it cannot be quantified, it's resonant, it's present.
Mm.
And just also just another textual piece going back to the question specifically, why can it be dangerous for therapists to start offering 5-MeO without proper training is that I think it's possible that some therapists have had they're psychonauts. Maybe they had a lot of experience with LSD or mushrooms or stuff when they were younger, or they feel really skilled as therapists. They can handle anything because they've seen everything. And there's a potential for hubris to come to that equation and just be like, well,
Mhm.
5, sure, it's the most powerful psychedelic, but I've had all these other psychedelic experiences. I've been trained with all these other molecules. I should be fine to be able to do this. And it's like, no, this is a different experience entirely. Yes, there are some similarities. My CIS training was awesome. My Polaris training for ketamine was awesome, but 5 has its own unique qualities. And if you think as a therapist, you think you're serving a medicine just like some of the other medicines that you're familiar with, you're going to be, in for a rude awakening. I guess you can get some humility, at great peril. So it's better to get the training first rather than some sort of trial and error learning, which can be devastating for therapists and for clients or patients.
Yeah, for anyone out there who's not aware of what, the possibilities that can, happen with uninformed facilitation, there's been plenty cases of extreme destabilization, cases of psychosis, suicidality, or suicide, death, a lot of very, very extreme things. And so, what we're trying to say is, yes, there's probably a lot of cases that people may be able to do with a shorter training. However, if they are not taking cases that involve trauma or involve any significant mental health issues, and then there's always going to be some that slip through the cracks. And so with 5-MeO, it is just very important to be prepared and be aware of all aspects. It's a big spectrum.
Mm-hmm. Thank
So
you.
I might jump in there. I appreciate, Joel, what you're saying about in another context, it might appear like an emergency
Mhm.
because of how people express themselves sometimes in a 5 experience. Um, and what I find so important about that is that if the facilitator in any way starts to panic or get anxious while holding space, then they're going to possibly infect or impose their own anxiety onto what might be actually the most beautiful experience of a person's life. Just because the person might be expressing themselves extremely loudly or something like that doesn't mean that they're actually in distress. On the other side, I might offer a brief personal example, and this goes into the category of what we call a challenging experience. Um, my second experience with Bufo, which I imagine most people here understand, is the original um, toad secretion that allows for these kinds of experiences. I think you work with the synthetic, and that's also what I work with. Um, but my second experience with Bufo, this is going back quite a few years now, was so because I had lovely people who served me, but they didn't provide preparation, they didn't provide integration. And the experience I had was so shattering and disorienting. It took me an entire year to integrate. And that's a very long story I won't go into. Very interesting process in terms of integration. But but that's me having, decades of my own inner work and being a psychotherapist. And that was really challenging for me personally to integrate. So being aware of those kinds of possibilities and those kinds of experiences feels so essential for facilitators.
Yeah. And there was a question from Mr. James here that was around what we're speaking about right now, just piggybacking off that last question. What about therapists who have done plenty of their own work and have worked with the medicine for many times over the course of years, What would be the difference in skill set they would gain from a program like yours? Or what is the risk of not completing a program like yours and going to serve? For me, I would say that having plenty of personal experience does not prepare us to serve. Because my own experience with 5-MeO DMT is going to be very different than Victoria's experience with 5-MeO DMT and Mr. Rogers' experience with 5-MeO DMT and Rick's experience. The processes are so unique, and if we're only seeing how our own process works and we're not seeing the extended frame of processes with other participants, so, for example, we're doing a lot of case studies and going over full processes in the training program where we're seeing what can come up in the preparatory process and integration process and aftercare that are unique to 5-MeO DMT because it does have a very, very wide range of display in how it works with people and how it shows up. I don't know if anyone else here wants to piggyback off any of that.
Yeah, just I think it's such a great question because, intuitively you could say the answer to James's question is like, okay, so you're a therapist, you've done a lot of work with 5-MeO DMT yourself, and you've served 5-MeO DMT to a lot of people. So you feel like you have all the skill sets, you've had all the experiences. The benefit of a training like Five, in my opinion, from my experience doing the Five training, is that it offers a kind of template that you have a strong foundation or grounding in a kind of template that you can pick and choose whatever aspects of the program really fit for you, but it offers such a strong template or foundation for all the different aspects of what can happen at all stages of a Five experience, from screening to preparation to facilitation and group settings with individuals, integration, all the different psychopharmacological considerations and trauma and spiritual frameworks. And I mean, it gives all of the things somebody needs that then you can go back and say, okay, well, I was already doing a lot of that, but I learned these things from the Five program, which were really helpful in improving my skill set. So again, I'm not advocating for therapists who have had experiences with Five and have served it a few times to just keep doing what they're doing and not take a training. But I'm advocating actually for this particular training program because me as a therapist with a lot of experience with psychedelics and 25 years of being a therapist, I just gained so much from the training, and even having done, like I said before, other psychedelic training programs. I'm also a self-confessed lifelong learner, so I will probably keep taking training programs until I
As
die.
should we all be. As should we all be.
Agreed.
Mhm.
One factor I would offer about the training experience is the community.
Mm.
When Rick and I were in the training program in 2023, it was the most beautiful group of human beings, international group of human beings, and we're still very connected. All of us are still very connected, and that has been such a wonderful resource and support. So regular support through connection on Signal and things like that. So that's actually a primary beautiful part of the training program.
Mm.
I love that. I hear all the time that those chats are blowing up.
I love it. I love it.
Uh, okay, Roger and Rick, as 5-MeO can bring participants into a deeply vulnerable space, can you explain why it is important for trainings to cover topics such as projection and interference?
So I guess I would offer that I think that there is something that's been a powerful learning for me is that there's been in spiritual communities in recent decades and probably going back much farther, there's been so much abuse of people in spiritual roles of leadership. And it's so tragic that we see this time and time again in psychedelic spaces, in yogic spaces, in meditation spaces, in the Zen tradition. We see time and time again where spiritual leaders are not taking responsibility for their own material. And so they can take advantage of a participant's vulnerability. So it's so important for us facilitators for Five to be aware that people may project, may idealize us, and in some cases may devalue us, like if they're having a challenging experience. So being able to navigate the projections that are coming to us, especially around wanting us to be a kind of guru figure or some kind of parent figure, being able to navigate that feels very essential because on the one hand, we want to be able to receive that positive regard. We don't want anyone to ever feel rejected or turned away. But on the other hand, we don't also want them to ideal us in a way that we can't sustain that projection.
Mm-hmm.
Yeah, it's funny. I can give a concrete example of this. One of the very simple yet profound take-home messages from the training, and we got to witness it together, when Roger and I were in the experiential portion of our program. But you guys taught us that, like, eye gazing, like staring into somebody's eyes. You don't want to do that. Of course, there's jokes like people doing psychedelics, like don't look at yourself in the mirror and those kinds of things. Like, eye gazing is a thing with psychedelics. But with Five, the kinds of stuff that can come up if we're not careful about our eye gaze, and you're like you don't want to be staring. We position ourselves next to the person. Of course, they can look over. If they look at us, we want to receive them, but we don't want to be eye gazing, staring right back at them. We kind of like give them a quick little glance and look down and be very, and I can remember some of the participants standing up in the middle of a F.I.V.E. process and like staring at Victoria saying, "You're a goddess, you're a goddess," and just, Victoria being very poised and just standing there, not staring back at the person, not either making any kinds of gestures or looks that could be misinterpreted some way. And it was really very, very well received as a coaching, as a training tool. And it's something I keep in mind all the time. It's again different than other psychedelic molecules. Yes, you don't want to be staring at people on MDMA necessarily. Maybe on MDMA you want to be doing that to some extent, or couples want to do that. But it has such a different, you don't really know what the hell's going on inside that person's, experience. And so, eye gazing
Yes.
could be so, I mean, I'm just piggybacking on what Roger's saying. It's just, that's such a concrete example of how projection or interference can really mess with the process if we're not skilled to like look briefly, look away, but hold that space so they don't feel rejected or, risk being idealized as a facilitator.
Mm.
Mhm.
I love everything that you guys are saying, and kind of what it's bringing up for me is one of the things that we teach in the training is always having another facilitator present. And in having another facilitator present, we have somebody that has eyes on us. What we're seeing is some of the biggest kind of harms that are happening in the space are people that run wild with facilitation without any co-visibility, without any mentorship, and we're not able to see our blind spots. That's why they're called blind spots. And so yeah, the thing that's popping up for me is, yeah, just how important that is, and having a co-facilitator and being able to see
Mhm.
our projection when we're in transference, countertransference, all of those things, and being able to unpack what happened in the experience after with somebody so we can learn from it. Okay, Joelle, I got a question for you. One of the more dangerous areas coming out of basic facilitation programs is a one-size-fits-all dose approach for every single participant. Can you explain why this approach is so harmful?
Yeah. I mean, everyone is extremely unique in their own ways, and we're all going to have different dosage thresholds with 5-MeO. We're all going to have different reactions to different types of dosages. We're all going to experience a full release in very, very different ways. And so, one example of how it could be very dangerous to go with a one size fits all approach is I think a lot of the basic training programs emphasize the full release dose as the standard and what is always to be worked up to if there is even titration upwards and it's not just starting right off in a full blast. And there can be some pretty extreme consequences there. There's plenty of participants that we do not take into full release doses. There are a lot of cases where it may not be safe for them to go into a full release, where there may be very, very significant trauma, or to use IFS language, very, very diligent protector parts. Sometimes working in those low to medium, those handshake and hug thresholds can be really, really effective, but taking them over may be a little too far. One example is we had a participant that we worked with. He was actually patient zero here at the Tandava Center in 2021. And his case was major depressive disorder. He'd been in therapy for decades and decades and decades, hadn't experienced happiness in over 30 years. Um, Came here. He had been doing active parts work already with this therapist, so he came really well prepared. And we did a lot of work with him in tandem with those parts to cooperatively and collaboratively work into the layers and work into what was coming up. During his process, he had a huge 180-degree turnaround. Even while he was still on site, he left like a ball of sunshine and was flying high for about a year and a half. During that time, got into a bit of a spiritual practice and met a facilitator in his community who was known to serve high doses. And he got piped to a degree to where they took him into full release, and he had a whiteout. He had no memory of the experience. But then, within a few days to a few weeks, all of his old symptoms from years prior came back with vengeance. And he went into debilitating depression and anxiety. And those can be the consequences of mowing over a protector part or taking someone into a full obliterated experience when every part of their psyche may not fully be on board for it. So, understanding what kind of dosage protocols may be appropriate for certain conditions is really, really important. If anyone else wants to add on there.
I guess I would just offer that in the spirit of being a lifelong learner, as we've been saying, um, I'm just constantly learning about dosage in terms of what is going to work for each individual. Um, and in that sense, the way that I serve with my co-facilitator is that we want to do at least two, hopefully three ceremonies over a 2 or 3 day period so that we have an opportunity to fine tune and adjust the dosage level. Because if, as you were just describing, Joel, if you overdose a person, it can be very destructive.
Yeah.
So learning, one of the things we learned in the training program is titrating up rather than just, kind of, I think there's a tradition with Bufo where you just pipe them, you just send them soaring, and which I experienced, and that was really, really challenging for me. So learning to gradually titrate up in a safe way is such a beautiful way to serve, and a beautifully safe way to serve five.
Yeah, and also just to add an interesting piece to this, and I remember Joel, you were on a podcast recently talking about the GH research. So bringing this into a research context with, how is this molecule being studied in research? And they have to do standardized dosing. And it's a very curious thing. Again, it highlights, in my experience, the difference between research and practice.
Yeah.
The research environment is a very sterilized, very standardized, very exclusionary. There's a lot of exclusion criteria for subjects and stuff. So it's just so interesting because that's research and it's super valuable. I'm a big fan of research. It's really helpful bringing this medicine someday under FDA approval. That's great. And also, like, in the real world, where people serve this medicine or use this, dosing is not standardized, and we have to be very, very careful. I during the training program, and I've had the honor of being able to be a shadow and a co-facilitator at Tandava a couple of times, and really, serving medicine, one day after the other, and each time a participant comes in and asking them, "How are you feeling today? What are you feeling about it's a real collaborative process, and where somebody feels like they're at in terms of where they want to go for their experience that day. And You know, the only exception I would say to that is I also had the pleasure of being a subject in the research study that was done at Tandava with an EEG machine. And so that was for people who have a lot of experience with 5-MeO DMT. They're comfortable with the medicine. They're self-identified as being Buddhist sitters, where they're calm. They're supposed to be calm when they, if you can predict that, calm when they have a full release. So everybody, there were 30 subjects, and everybody had 12 milligrams
Yep.
on the lamp. And, you know, even though they were identified as being a Buddha sitter, about half of us actually stayed quiet the whole time, and the other half were flopping around. And, you know, I don't know what happened to that data exactly, but that's an example where you can standardize the dose in certain circumstances, but that's sort of rather an exception rather than the rule.
Mhm.
Mm.
Yeah, that
Hey,
was, we did find that to be a little bit of a limitation in that study, not being able to individually dose, as that was a proper study. Going with that uniform dose was difficult. That was confrontational for some people, they were like, wait, it's going to be 12 minutes. That's a lot for some people. And yeah.
well, I think I'll ask one more question and then maybe we can hop over to the Q&A. What do you think, Joelle? Yeah?
Let's do it.
All right. You guys have already been kind of sharing about your experience. More if there's anything else that you want to share. So our aim with this training program was to create a gold standard for 5-MeO DMT training. We've been blessed with the trust of you two, the two of you, as well as with many other mental health professionals in this. Would you two share how you feel about your experience with your time in the cohort?
Rick?
I mean, I think again, just to emphasize some of the themes that we're talking about tonight, one thing is safety. You know, to be in a training program where the people who are running the training program, the instructors in the training program, just, right away you have a sense of like these are trustworthy people. There's a sense of safety being modeled here for us. And learning, and feeling that sense of safety as part of the training program, it's one way to really, stay in reverence for the power of this medicine and the responsibility of serving it. And then I'll just emphasize what Roger said again, and it can't be emphasized enough: community, community, community. To being part of this community, not in an exclusionary cult like way. And we're joking about that, like you have to get a mandatory tattoo or something like that. But I don't have any tattoos yet. But
Me neither. Me
but
neither.
not, community is so important. We're just like we're all connected, and this medicine comes with a certain responsibility that, staying in community, accountability, sharing our experiences with one another, witnessing other people's growth and process. It's just so it's like the most vital piece of the training program.
Mm.
Um, s- yeah, for me, I mean, honestly, to put it in simple terms, and then maybe I'll expand a little bit, there's so much to learn. And even for people who have a lot of psychological training or who have already facilitated experiences with five, especially when you're working with the synthetic molecule, um, there's so many routes of administration. There's so many different possibilities in terms of working with low dose five, in terms of working with hug doses. There's so much to learn in terms of the whole process that we learned in the training program, going from a rigorous screening to preparation to ceremony itself to integration. Like that whole process and all the small and big steps all the way through that process are skills that I use every single time that I am co-facilitating an experience with a molecule. And I honestly, everything we learned, I'm constantly using as I'm facilitating. It's quite remarkable. There's so many moments where I'm like, what do I do now? And it's like, oh, I know what to do now. I learned this. So that's been really great. Really, really, really great.
Thanks,
So
Roger.
Thank you guys. Joel, you want to pop in with a question from the Q&A?
Sure, sure. Yeah, we can take turns. We can fire back and forth if you want.
Sure.
I see one that I really, really, really love. Um, it's a great question. It says, for any or all of you, as a facilitator that provides thorough intake in the best container you can, how do you process the feeling of responsibility for a client that has had a very bad experience?
Mm.
And I love this question. I'd love to hear everybody's thoughts or anyone who wants to chime in. But first, I would say it's hard not to feel a little bit of some feelings when you're watching someone just go through a real tumultuous experience. The real important thing is making sure that we're never serving outside of a container that can hold anything that's coming up. Because it's not about avoiding a challenging experience. It's not about trying to make the experience itself nice and pleasant. Most of the biggest growth comes from the hard hitting, real rough experiences. It's making sure that we as facilitators or having people on our faculty, having people on our staff or team that can handle these types of things and help someone unpack that challenging experience and really integrate those lessons into life. But then in terms of, I would say that's the best way we do. I would say, I can speak for Victoria and myself. We've overseen a lot of processes, and I mean a lot of processes over a long time. And you get to see patterns and you get to see someone may be going through a grueling, really scary, challenging experience. But we've seen firsthand over and over and over the amazing growth that can happen during the few days after that and during the integration process over the next few weeks and few months. And so I would say that gives us a much deeper level of comfort there, just knowing that just because they're having a scary experience on the medicine doesn't mean anything. A lot of our preparatory work is geared around preparing them that in case they do have a challenging experience, preparing them on what to do if it comes up and how we're going to go about it processing it. Anyone else want to add anything there?
Well, just to echo some of what you're saying, Joel, a phrase that I learned in the training is that integration begins before ceremony. And so I feel like the more I can do, like you were just saying, to prepare an individual and to be fully honest with them about what happened in terms of possibilities with challenging experiences, with trauma coming up, things like that. Then at the other end, then there's already a connection that can support into proper integration. And then I want to do my very, very best to provide as much integration support as a person would need. Uh, and sometimes people need a lot of integration support. And it really, really comes from the heart to be able to provide that, whatever an individual needs.
Mm. I think for me, it's important that we make a differentiation between a bad experience and a challenging experience. When I think of a bad experience with 5-MeO-DMT or any other psychedelic, I think of an experience that is harmful. It has somehow harmed this person in a bad way. Versus if, in the question, they're saying if you've given all the right preparation, the container's airtight, and they're still having a bad experience, I would then call that a challenging experience. And just like Joel shared, it all comes down to the preparation of them understanding and having frameworks around the challenging experience. So when it comes up, it's able to be received rather than have an aversion towards it. And in addition, I think it's really important for us as facilitators. That's why we need this experience ourselves, tons of experience with the medicine, so that we have also had challenging experiences with the medicine, not just on the mat, but in the integration. And that, it's very, very similar with, when we talk about allowing medicine, and sometimes that allowance doesn't happen, but that when we're on the medicine and that challenge is coming up, to just be with it and to just let it happen, to just let it process and move through you. If it starts to get challenging in the integration process, the same rules apply. And, we even see that as far as into reactivations, where maybe they had a challenging experience on the mat and there's still stuff that's trying to move and there's still stuff that's trying to arc. And so it's coming up in reactivations. And so then being able to support people into that. So I would just say, us having our own experience and understanding that the challenge is a gift, and all of the treasure is in there. And if we can really dive into it, that can give us what we need throughout the entire process. Giving that kind of framework can be really helpful.
Yeah, and also just to add a little bit more to it, I echo everything that you guys have said, and processing the feeling of responsibility is is the name of the game. You want to process it with them. You, as a facilitator, we must take responsibility with humility. If we miss something along the way, we take responsibility. We process it with the person. We allow them to express whatever they need to express. We're honest with ourselves. But even more, again, going back to the whole community thing and having eyes on each other, like that's how we as facilitators process things is with each other. If we hold each other accountable, if I feel like I worked with somebody and they had a bad or challenging experience, if I have colleagues who I can process it with, that's really helpful. But again, I mean, not to skirt the issue, like process it with the individual. Be accountable, process it, take responsibility, and just always remember it's a collaboration. It's not just the client or the facilitator. It's so many things. I go back to the woo woo stuff of like the lineages and calling in all the directions and all the different elements that are outside of our immediate awareness that are all co-conspiring for this whole experience, and bringing all of that in to help metabolize whatever is really challenging for the person, whatever if they're left with something that's really they're struggling with, like pull out all the stops and just be present, be accountable. Yeah, there's so many different factors to taking responsibility for sure.
Hmm.
Mhm.
I've got a question that I think it's probably geared more to around Dr. Rick and Roger. So from Ron, I'm reading Swimming with the Sacred. Can you speak to the difference between being a guide and being a therapist?
Yeah, I saw the author of that book speak at Denver in 2023. I forget her name. She lives up in Maine, I think. But really a profound book. I mean, I think those honestly, those facilitator, guide, shaman, therapist, priest. I mean, they're all used interchangeably at times. I think as a therapist, licensed and all this stuff that comes with it, there feels like there's other things at play than being a guide. I don't think one is necessarily better than the other. I know plenty of guides who are awesome. I'm looking at two of them that aren't licensed trained therapists, and there are some licensed trained therapists who have no business doing this work. But oftentimes, in my opinion, I think those those terms are used interchangeably, and I think we kind of I don't know. When I go to Mexico, I set down my role as therapist, and I just become a person as part of the process. And there's really no distinction in those kinds of settings for me anyway.
I might just offer as one reflection. I'm not familiar with the book, but that for me, being a therapist is an ongoing therapeutic relationship where I have a responsibility to help the person work through their issues. Whereas a guide, to some extent, I mean, I want to provide as much support as a person needs. But as a facilitator of 5-MeO DMT, I want to get out of the way as much as possible. Um, there's been way too many guru types, shaman types who are imposing a particular lens onto 5-MeO DMT or other kinds of experiences like that. And my job, and we learned this in the training, I think in a beautiful way, is to get out of the way. Like you were saying earlier, Rick, about eye gazing, right? Like get out of the way, let the person have their own experience. So a positive definition for me of guide would be that getting out of the way of the person's experience.
I love that. I love those answers. I'd also just add, I would just say a therapist is someone who has undergone therapeutic training, specifically gone through the process to become a licensed clinician and has overgone mentorship and supervision. And it is a very, very welcomed addition, a very, very beautiful addition to someone's facilitation practice. And if you are serving 5-MeO DMT and don't have any therapeutic training, it's probably really helpful to have people that you're working with or within your close network that have psychological and psychiatric training that can be of support if and when those situations arise.
Mhm. Get the next question,
Oh
Joel?
yeah, it's my turn. All right. So I've got a question. Can we list some concrete examples of 5 trainings that have been harmful? So we're going to try to do this, or we are going to do this without naming any trainings or any people or any organizations, and just say that yes, in our training, actually, there's a series of case studies that you watch that are people's processes that are people who have reported being traumatized from their experience, and it's video interviews with them and hearing about their whole process. Um, we kind of are one of the main places where a lot of people reach out to when they've been harmed from their experience. And we've had a lot of people reach out very, very destabilized, coming from, we'll say, coming from a notable, very, very short 2-day training. There was an
Mm.
unfortunate situation last year, to try and give a concrete example, but keeping it vague enough to not point towards anybody. There was a death, a suicide last year in Canada. And the facilitators there, the training program just involved a lot of medicine rather than skill sets and understanding what to do when someone goes into some of those states. There have been, yeah, it's very hard to give examples without giving any hints that might hint towards anyone. But I would say, yes, as an organization that fields a lot of reports of people being harmed from their experience, and also us doing field studies, we've done a few survey studies that we've put out in the communities over the past few years, and a lot of the information we received. Um, there's one that I can actually probably hit 2 birds with one stone. Um, we did a survey, what was it, last year, year before, and a lot of people had been reported feeling a bit destabilized or harmed from their pen experience. We know that there's a lot of pen trainings happening right now where there's not prerequisites of personal experience, and they are very short trainings that only go into low dose approaches. The problem is low dose 5-MeO does not always guarantee a low dose experience. 5-MeO is highly unpredictable. And so there were quite a few people that reported getting a bit more than they bargained for in their experiences through that, and that came through a specific pen training as well.
Mhm. Yeah, the one thing that's popping up that I wanted to actually this training program, the amount of medicine that some of the training programs are requiring of the students that are going through the programs is it's crazy. There's one program that in order for you to pass it, you need to have 30 days in a row of full doses of 5-MeO DMT. And for me, that's really scary for many different reasons. But we're for those of you who may have listened to other webinars that we've done, if we're doing that medicine without integration, 100% we are ego inflation and the traps and the risks there to both the facilitator and the participant afterwards of stepping into facilitation that way are really large. So I just wanted to speak to that. I have got a question from an anonymous attendee. What would be the advantage of a client doing 5-MeO therapeutically versus another medicine like psilocybin?
Ooh.
Um, well, for me, um, it's so different. There can be places where there are parallels between a psilocybin experience and a five experience, but um, for me, 5-MeO DMT is so much more of a direct experience into what I would call the divine. Um, and it's like and it creates an experience like a kind of like more real than real experience that there's something more than my mundane existence. And that can happen with psilocybin too. But psilocybin is much more of a kind of, at least in my experience, emotional journey. So that can be very meaningful and can produce different results. But there's nothing like five, in my experience, that moves so directly to an experience of source or God or non-duality or oneness or unity or whatever language the to experience that level of the ineffable can be so profoundly therapeutic, providing a new foundation for life.
Mm. Mhm.
Yeah.
It's hard. That's a hard, for me, that's a hard question to answer. I mean, I'll just say it. I don't want to offend anybody, but like there is a little bit of there's a little bit of it could be interpreted as elitism. You know, there in the drug world, there's this phrase of psychedelic elitism, like, where people think like psychedelics are like a special drug and better than like cocaine and heroin and all that kind of stuff. And a lot of us wouldn't debate that, but I understand the thinking behind that. And then even within the psychedelic space, there's this elitism around 5-MeO DMT. And it is a special molecule. The advantage of it is that it is powerful and it does reliably produce these really, when I talk about it, I can feel the energy in my body. It's very, very powerful. And also, like, is it better than other psychedelics? I mean, it's really nuanced, you know, it's really nuanced. Psilocybin is a very, very powerful sacred molecule. MDMA is too. All, you know, all of these experiences, depending on set and setting and the people you're with and, you know, how ready you are. There are advantages with five because of its power, but it's hard to say. You know, I think, again, I don't want to, you know, rock the boat much here, but I'm leery of like this game changer kind of you know, mentality, and every time I hear game changer, I'm like, we need to appreciate the power of this medicine, and also, like, you know, there's so much more to it than just the drug.
Yeah. I really, really
Oh, for
agree.
sure.
I think that's really important. And I think, a lot of people who are, I do pretty much all of the discovery calls for Tandava. Still, just it's great to get to establish contact with each person that's looking to come here. But I get asked that a lot. And why 5-MeO? Why should I do 5-MeO over another medicine? And what I always tell them is there's really no right or wrong answer here. It's not like you're going to make a choice and end up on the wrong, like do the wrong psychedelic and not get the healing you need. They're all just keys to different doorways that go into the deeper layers of ourself. Some go a bit deeper than others. Some are a bit more explorative in certain layers and certain realms. And it's really about, what does the participant feel drawn to? What do they feel? Do they feel drawn to a very, very profound, big experience? Do they feel drawn to a more subtle experience or a more lengthy and drawn out experience where they can engage and interact with the intelligence of the medicine? There's a whole lot of different flavors, and it's provided it's done safely and effectively. I think they're all beautiful options. And so, therapeutically speaking, it's not that, except for MDMA, because the way MDMA targets decreases blood flow to the reptilian part of the brain and increases blood flow to the prefrontal cortex. Aside from that, all other plant medicines and psychedelics can be used for most therapeutic purposes. It's really dependent on the container, the therapeutic modalities that are involved. None of these medicines are cures. They're just keys to big doorways. And 5-MeO, is in clinical trials for treatment-resistant depression, major depressive disorder, PTSD, substance abuse disorder, quite a few things. And again, just like Rick said, it's not about the drug. It's about a whole lot more than that. And so its therapeutic efficacy is going to be a lot more dependent on the skill sets of and environment of facilitation.
Hmm. Speaking about PTSD, I have a question from Mitchell. Any thoughts on what PTSD treatments you might want people to try before turning to our beloved 5-MeO?
Dr. Earlywine is a friend, colleague of mine. It's a great question. Um, I think there's this idea that psychedelics, 5-MeO included, is like 10 years of therapy in a single session. And I think it's a dangerous connotation. There's a lot of work that can be done with trauma before jumping into 5-MeO DMT, whether it's EMDR or somatic therapies or talk therapy or all kinds of tools that really do actually help a lot of people. I think therapy sometimes gets a bad rap in favor of, highlighting the power of psychedelics.
Yeah.
But there's just so many, to Mitch's question, there's so many really tried and true good tools out there that therapists can and do use to address trauma. And if someone's still struggling, then things like MDMA or 5-MeO or ketamine or whatever can be really powerful additions. And then, the idea of combining the two, there are people who are doing EMDR on the heels of a 5 experience, like literally like in the hour following the 5 experience doing EMDR to continue to process the trauma, and that's a whole, new and unexplored territory that people are fusing things together like that. It's pretty cool. So there's a lot of great therapies for trauma out there, and I think a lot of people should avail themselves of it if they can before jumping into 5.
Mhm.
Yeah, I actually think that can speak a little bit to Jackie's question. And hey, Jackie, she's asking around different protocols and methods and how to determine when what is needed. We're not going to go into how and why we use specific protocols in this webinar, but we do in our training program. Um, you know, 5, particularly in low to medium doses, pairs very well with different therapeutic modalities. Just like Rick was saying, doing EMDR on the tail end. Somatic experiencing is extremely potent with low dose 5-MeO. Internal family systems, IFS, can be really, really potent with low dose 5-MeO. One of the really important things, though, is to make sure that someone is fully trained in 5-MeO and not just trained in low doses, because way more often you would think low doses will lead into a full release experience, especially if we're working into trauma layers. There's going to be a big catharsis that's going to result in a very significant experience. And so making sure that the resources are there to hold whatever comes up, but low and medium dose 5-MeO pair very well with quite a few therapeutic modalities. And one of the great things is if you've got a lot of skill sets or you're working with a good team that has a combination of a lot of really good tools and skill sets, you can really show up for your participants in beautiful, beautiful ways and really provide a container that is really relevant to their process. All right, what do you think, Victoria? You want to get another question?
Let me see here. Let me know if you see anything on your end that's
I've got
popping
a
up.
good one. I've got a good one here from Mr. Christian. Just asking, what do you think of the idea of a facilitator that informs clients on the different ROIs and then offers the client the choice? Is that irresponsible in your opinion? I would say, did I just freeze?
No, you're good.
Okay, good. Sorry. Everything froze for a minute. Um, I would say it's a beautiful, beautiful thing to work collaboratively with the participant. At Tandava, we work with all of our participants during the preparatory process, first offering them all of the different options, explaining the differences and nuances of the different ROAs, and allowing them to have some say. Of course, safety is going to be a consideration. There's going to be instances where Toad isn't going to be safe. Toad is not going to be safe if there's cardiac issues, elderly participants, or if you're trying to stay within the low to medium dose realms, because we can't have dosage accuracy with Toad. But yeah, working with and giving your participants a choice gives them another sense of ownership in their process, allows them to feel empowered. I love it. You find one, Ms. Victoria?
Well, there's a few there's a few questions in here that are asking the same thing. So I think maybe we should address it, even though it's like a little bit
Better
off
not
topic.
be. Better not be Toad and synthetic. It is, isn't it?
It is.
All right, can we just give this question as little time as humanly possible? So
Yes.
it's the same. It's the same experience. Yes, there's a debate. Does the Toad version have the spirit Funny enough, synthetic 5-MeO was being smoked before toad was ever being smoked. It's a very, very
Mm.
different situation than all other psychedelics. The subjective experience is the same. There may be a few different nuances with the body load with toad. Some samples have bufotenine, some don't have bufotenine. The samples that do, it's thought to be a trace amount that's not going to affect. There are ethical concerns and safety concerns around toad. They do not have the same safety profile. We love both medicines. We love the pure molecule. We love toad. We're very emphatic about promoting use of synthetic for ethical, safety, and environmental issues, but we do not shun the use of toad. We just encourage you, if you are using toad, know your source, know where it's coming from, and also know that the lack of dosage specificity and the different safety profile means a different kind of screening for your participants. But that being said, we love them all, and we feel that spirit is with all of them. If you hadn't noticed, it's kind of an old issue that was debated for a long time.
Well, there's a few other questions in here. Should we get into those?
Let's grab one more. Um, let's see here. This was a great one, and I don't think we got to this. I meant to get to this earlier from Mr. James. Are there ways to safely serve this medicine to those with personality disorders? It is commonly discussed in the community that this medicine could make their symptoms worse. Could it be healing? If worked with properly in regards to the client's needs? Excellent question, James. Roger, would you like to start off on that one?
Yes, my experience is that I've become more open to this possibility. Um, it depends on the personality disorder and it depends on the individual. Um, Borderline personality is an interesting choice because there's a lot of stigma in our pop culture around borderline personality, but a person with borderline personality often is more willing to access therapeutic services and is more often willing to work with their trauma. And so I have found that if the person, has enough support, both professionally and personally, that a five experience can be quite healing and profound. And I think that's relevant for some of the other personality disorders too.
Yeah. I love that. I think nuance is important because I think a lot of times it's people think that it's an automatic no. There is I think the big variable here is, does the facilitator have the skill sets to hold that process?
Yes.
Does the facilitator have a familiarity with that personality disorder and understand how to hold it in its inflamed displays? Because in all likeliness, there will be some extreme highs and lows and inflammation of symptoms through a 5-MeO process. Doesn't mean it's a bad thing. It just means it needs to be held by informed care and someone who really understands that. But unfortunately, there hasn't been a lot of research on it yet. Hopefully, there will be soon. But yeah, myself personally, I would say there is potential. It is again the factor of the right support. I know we've worked with a few people with a cluster B or personality disorders here, and then some who we have referred elsewhere because we did not feel that this was the appropriate process for them.
It
Mhm.
really depends on the severity of the
Yeah.
personality disorder because a lot of people will self-identify as saying I have borderline or I've been called narcissistic or whatever. And is it a real, is it, who is doing the diagnosing? Is this just something that somebody read in the DSM themselves and they self-identified as having a personality disorder? There was a participant in the one of the retreats that I shadowed at Tandava last year who identified as having borderline. He had a great experience down there and it was fine. So I think, also going back to Roger's question earlier on in this webinar was, this whole idea around psychological disorders and like who's doing the diagnosing and how severe are these diagnoses. And five is, we said it 1,000 times, it's such a powerful molecule that it sheds all of those constructs. It completely blows you out of the water, out of all of those things, and brings you into a space that is beyond any kind of diagnostic category. I think with personality disorders, the danger is on the back end coming out with these idealized or devaluing or these taking on godlike ideas about oneself, and that's a real danger. But I agree with what Roger and Joel said, that it is possible to serve this medicine safely to people with personality disorders as long as you're prepared for what might happen.
Yeah. And I'll just say too, I think it's really important for us as facilitators as we're going through that screening process. For example, if like Joelle and myself, we're not clinical therapists, we can't give that diagnosis to folks. So having people in your network that are able to maybe meet with the participant and see what their diagnosis is before we say yes to serving this person.
Yeah, exactly.
All right. Well, I see we have
Questions from
just
the audience. Thank you. Thank you, everybody.
thank you guys.
Yeah.
Thank you.
We have a few more minutes, so I just want to close out and want to ask both Roger and Rick if there is somewhere that our listeners can find you, whether, websites, social.
Roger, I'm hopelessly addicted to social media, and so anybody can find me on social media, on Instagram or LinkedIn or Twitter X, and so Dr. Rick Barnett is my handle on most of those, and I do respond to direct messages, and so yeah, I'm happy to connect with people.
Um, and you can find me at Roger Kaufman AZ at gmail.com, and also at skymountain.one.
Beautiful. Thank you guys. Joel, you want to share some of our announcements?
Yes. So what were our announcement? Well, first of all, our registration is open for our September 2025 cohort for the F.I.V.E. training. So if you are feeling inclined and like you may want to come and join the community and be a part of what's going on here, just visit the F.I.V.E. site. And Victoria, would you put the maybe put the thingamajigger up in the, oh wait, I don't think everyone can see it in the chat. Just visit the
No.
F.I.V.E. site and you can apply for the training right there, and we'll set up an interview. We do offer payment plans, so you can pay off over a year as well. And just a reminder, we have our free community bi-weekly integration circle. The next one is tomorrow at 3 p.m. Pacific, and that's 6 p.m. Eastern. The link is also on the F.I.V.E. website. And then also, we have our level 1 integration training that is also available on the F.I.V.E. site. That is a 10-class level 1 course on the nuances of integrating 5-MeO DMT. And that is led by our head of integration, Otto Mayer.
And if anybody has any questions, I'm going to just share the email to the F.I.V.E. account. So it's info@FIVE-MEO.education. Let me know any questions you have and we'll get to those. And so, yeah, I just want to say thank you guys so much. Thank you, Roger. Thank you, Rick, for carving out time this evening with us to share your wisdom. It's been an absolute gift to have you here. And thank you, everybody else who came and joined and offered amazing questions.
Yeah, thank you all for joining us, and looking forward to seeing everyone somewhere at some point. Have a
Oh,
good night.
I have one more thing to say before we pop off. We're also going to be at MAPS. So if
Yeah.
anybody's coming to MAPS, we would love to see you. We're going to have a booth. We're also going to have a kickoff party with Parangai and Savage. It's going to be a real shindig. So hopefully we get to see you all there.
Yeah.
All
Have a
right,
good night,
everybody.
everybody.
Thank you,
Ciao.
guys.
Ciao.